Today we are taking further action to maximize our oversupply in available ventilators. This afternoon I met with the leaders, the top people of many of America's big, powerful, beautiful, and very, very important hospitals and hospital associations who join us today. We had a great meeting, learned a lot. And they've been going through a lot. They've been doing a fantastic job, as everybody here will attest. I'm pleased to announce that my administration is partnering with the hospitals across the country to create an innovative new system called the Dynamic Ventilator Reserve, so that we're going to have tremendous numbers of ventilators that we're able to help our states with at a later date. If there's ever a problem like this, which we hope to God will never happen again. It was 1917, 1918. That's a long time ago. We hope it never happens again. And I'd like to ask Rick Pollack, CEO of American Hospital Association, Sam Hazen, CEO of HCA Healthcare, that's the largest in the United States, Warner Thomas, CEO of Ochsner Health, and if I could, My Hall. Are you here from Cleveland Clinic? Somebody? Good. Thank you. Come on up, folks. Please. Thank you. Say a few words.
Thank you very much, Mr. President. We appreciate the opportunity to work with you and your team on the Dynamic Ventilator Reserve Program. This will provide a really important mechanism for us in serving our patients and communities by ensuring that this vital equipment will be available to critical areas that are in need. As this battle against this disease has affected the country a little bit unevenly, the rates of infection, hospitalization, and ICU use varies from one region to another. In some places with lower infection rates, some ventilators may not be in use, while other areas are potentially stretched beyond their capacity. The database of available ventilators that we are creating will allow us to flex so that we can make sure that available equipment can be shared with those in need. We appreciate the leadership of the health systems that are here today that has stepped forward. And Adam mentioned a few. I don't know if he caught Dr. Fritz Francois from NYU Langone and David Dill, the CEO of LifePoint as well. We appreciate the work of the administration in helping us find innovative solutions to ensure the best care for our patients. We'll continue to work with hospitals and health systems across the country to add to this reserve further. Your team has provided us with important leadership, and we look forward to working with you in making this a success. Thank you, Mr. President.
Thank you very much.
Thank you, Mr. President, Mr. Vice President, Adam, the team. I stand here before you in front of our 285,000 colleagues who provide care to patients every day across the country. One of the guiding principles we had when we went into this COVID-19 battle was to find partnerships with other components of the industry, partnerships with other health systems, but partnerships with governments, both local and federal. And we're proud to be a part of this private-public sector partnership, and I think it's going to do great good for the community. So thank you very much.
Great job. Thank you.
Thank you, Mr. President. It's great to have Ochsner Health be part of this program. We certainly have been a recipient, and the state of Louisiana has been a recipient of help getting ventilators to our state and to Ochsner Health. We're currently taking care of about 60% of the COVID patients in New Orleans, and we did see a spike over the past few weeks, but we're starting to get on the other side of that and heading in the right direction. I also want to thank you personally for helping Ochsner Health. A couple weeks ago, we were running short on surgical gowns, and you and your team were able to direct some to New Orleans, which was helpful to us and other hospitals around the New Orleans area. So we're excited to be part of this dynamic ventilator reserve, and we are proud to be part of that and help other communities around the country. Thank you.
Thank you, Mr. President, for the invitation here. On behalf of the Cleveland Clinic, I would just like to offer a slightly different story about the COVID pandemic. In our home state of Ohio, with an early institution of social distancing, our ability to scale up the testing and ramping out the capacity, we have actually seen a stable number of patients over the last 8 to 10 days. Only 160 patients have been hospitalized with COVID infection in Cleveland Clinic Health System. We are also very grateful for the support from our state government as well from our federal government. This is a battle where we're all in together. We coordinate our efforts, share our resources, and work together as one. I'm firmly convinced that we can do a lot of good when we work together. Thank you very much for having us. Thank you, sir.